very good morning to you. My name is Howard Feldman. This is the Sunday podcast, courtesy of Synthesis Technologies. Each Sunday, I chat to Dr. Anton Meyberg. He is a physician pulmonologist in private practice. He's an expert on COVID-19, and we ask him your questions. This is the third podcast, this Sunday, April the 5th. And again, we thank you for the immense amount of questions that you've sent our way. You've sent it per email, Facebook, Twitter, and some even telepathically. For those that did so, we appreciate your trust in us. Dr. Meyberg, good morning. How are you?
Good morning. Thank you for having me. As you can see, I'm at home today. I'm not at work. Back to work tomorrow morning. But we're here to answer some questions, some myths, some things that are causing people havoc, and hopefully try and answer these questions and help you out and help you get through this lockdown a bit easier.
All right, so let's kick off. We are on day, I think it's number 9 of lockdown here in South Africa, and lots of talk. People are saying it's 9 of 21, others are saying it's just day 9, because we're starting to see all sorts of graphs around what is good for us in South Africa, what is good globally, and what isn't. Let's understand from you, if you don't mind, how we are doing. 1,580 deaths, I think, not deaths, God forbid, cases at this point. And is that better than we were expecting, worse than we were expecting? What does it mean in terms of lockdown? Tell us everything, don't leave out a thing.
Okay, so I think let's just go to the actual global figures. At the moment, we're sitting on 1,200,000 cases of corona worldwide. There have been 64,000 deaths, and there have been 247,000 people that have recovered. Of those 247,000, they're doing very well. Of the actual total, 890,000 people have active cases at the moment. And of that 890,000, 847,000 people have got mild cases, and 44,000 have got severe to critical cases. The United States has overtaken the world. They've got over 300,000 cases with over 8,400 deaths. South Africa is sitting on 1,585 cases with 9 deaths at the moment. So the question is lockdown working? And the answer is hell yes, lockdown is working. It is working well. But the problem comes now is what's next? Is the lockdown going to be long enough? Or can we just go back to normal life after the lockdown? My personal feeling at this point in time, and the feeling of many experts around the world, is 21 days is not going to be long enough. So I think you're going to have to brace yourselves, because hopefully the government will declare that the lockdown needs to be extended. And we're not talking about 5 days. We're talking about maybe a week to 2 weeks, preferably 2 weeks. Yes, it's going to cause major financial distress, but the amount of lives that it's going to save is innumerable, and it's priceless. So we're not here to talk about the financial things, because that's not what I do, but we're here to talk about human lives. And the lockdown is there to save human lives. We are flattening the curve at the moment. It is helping with the flattening of the curve and helping with the healthcare workers to work in hospitals and not be overloaded at this point in time. If we can continue it and maintain it, please God, we can do very well.
Right. Okay, so we are doing well here in South Africa. We are flattening the curve. 21 days, in your view, is not going to be enough. We're going to need an extra week, let's say, or even 2 weeks, which is what you think would be, you say 2 weeks. Okay, so I thought maybe we could negotiate a little bit. There'd be a little bit of room there, but clearly not much room for negotiation. Okay, a big question that many of the viewers are asking me is to mask or not to mask. I'm very confused about it. Part of me feels that, well, maybe you blokes are saying don't mask because you want to keep all the good masks for yourselves. Part of me feels that that we just want to feel we're doing something, so we cover up with a mask.
I think you should stop being so feely and so touchy and emotional. Okay, so it probably is the most controversial question of 2020, to mask or not to mask. Mm-hmm. Up until last week, the answer was definitely do not mask. Things are changing. The virus is spreading, especially in places like in Israel and places like Pinkeye, where there's a huge contingency of people that have got sick and that are cohorting the virus together. Definitely, you have to mask there to protect yourself from people who are spreading the virus who are not masking. Should people in Pinkeye be masking? Yes, they should be masking. The World Health Organization still states that you do not have to mask if you're going out unless you are sick. And by sick, we mean you've got a fever, you've got a cough, you've got shortness of breath, and you're at risk of spreading the virus. The CDC, the Center for Disease Control, came out on Friday or Saturday with the statement that people might have to wear cloth masks now when they go out. I mean, the virus is out of control in America at the moment. So yes, we do want to protect healthcare workers by saving the masks for them. But the masks that we want to protect healthcare workers with are the N95 masks. That's a mask that basically protects you from 95% of bacteria and viruses that can be spread to you. And you don't need to use that as a person in the street or person going to the shops, because you're not dealing with what we call aerosolized spray when you're putting a tube into someone's mouth or you're doing physiotherapy and then they're coughing straight onto you. So even a surgical mask at this point in time is not 100% necessary to be worn when you go out. In South Africa, our ruling is that you don't have to wear a mask when you go out. But people are panicking, and people are looking at what it says in this country and what it says in that country. So my advice is do what you feel is right for you at this point in time. We can't say to you, you have to wear a mask, you don't have to wear a mask. I'm not going to wear a mask when I go out, but no one should judge you if you do wear a mask when you go out. As I say, if you're feeling sick, put on a mask. But if you're feeling stressed and anxious and you're going to pick it up, then put on a cloth mask or wear a scarf when you go out to protect yourself.
Okay.
You've got to protect yourself, but even more than protecting yourself, you've got to adhere to the social distancing. If you go to the shops during lockdown, people are not adhering to this. People are standing right next to each other. People are standing on top of each other. You're not keeping the 6 feet or the 1 to 2 meters that you should be doing. You still need to be washing your hands inside the house, outside the house. Adhere to the social distancing, adhere to the hygiene. And I say, if you want to put on a mask, put on a mask. We're not going to judge you. It's not right. It's not wrong. We're kind of in the middle for this at this point in time. When you do put on the mask, make sure your hands are washed before you put on your mask, and make sure you don't put your hands over your face all the time. The problem with the mask is at least you're touching your face more often. You're going to readjust it, put it up and down. You're going to put it on. You've got to put it on correctly and take it off correctly. And by taking it off correctly, we mean take it off from the back and put it down. Don't keep on touching it, and then you end up touching your face and all other areas.
Would you agree with the following statement? If you live in an area where there's a tremendous amount of spread and you have to go out to get food or whatever it would be, then wear a mask. If you're going into an area where that is highly populated and densely populated and you won't be able to practice safe social distancing, then it's probably a good idea to wear a mask. But if you're going to an area where it isn't overly crowded, and you should be able to practice social distancing, as long as you adhere to all the other principles, you shouldn't have to wear one.
Yes, I do agree with you. I mean, let's put it into practical terms. If you're going to the shops on Wednesday morning before Pesach starts, before Passover comes in, the shops are going to be mad, even in the lockdown. So if you're going to a shop where they adhere to the social distancing, where they say to you, only 6 people allowed in the shop at a time, keep 1 meter distance, 2 meters distance from your partner, then you don't have to wear a mask. If you're going into a grocery store where everyone's on top of each other and everyone's touching and doing and this and that, then probably you should wear a mask at this point in time. And once again, the mask you can wear is not a definitive mask. You can wear a cloth mask or you can wear a scarf. People, the people who are also most at risk are people who are coming in taxis. People in taxis should be wearing masks. There's no doubt about it. They're on top of each other the whole time. They should be wearing masks. It's very important that.
Okay, and but you can take a scarf and you can wrap it around your face. It's so
as long as you're covering your nose and your mouth at the same time. You must cover both. It can't be below your nose.
Yeah. I've seen a couple of geniuses at shopping malls wearing them over their foreheads. You say that's not particularly helpful, the mask.
It will protect your hair, not yours.
Well, yeah, all right, so that's a problem. All right, before we get on to the very specific questions, tell me about gloves.
Gloves we don't recommend at this point in time because you're going to put on the gloves and you're going to touch something, then you're going to touch that onto your body or touch on something else. Wash your hands, hand hygiene, keep on washing with 60 to 70% alcohol solutions. When you're at home, wash with soap and water, keep on washing the whole time. Watch what you're touching. Don't touch your face, don't touch your eyes, don't touch your nose. Stay away from those areas. Gloves are not necessary.
Okay. Is there a link between the BCG vaccine and the low current number of cases in South Africa? I see this question popping up a lot. What is the BCG?
So the BCG vaccine is a vaccine that's part of our national vaccine sort of that we give to the country. Everyone gets a BCG vaccine, which is against tuberculosis. The thought process is that this BCG protects us against certain respiratory infections. Now, do we know if it works or not? We're not 100% sure. But if you look at a country like America, or if you look at a country like Italy, they don't have BCG in their national vaccines. So they are basically BCG naive. Whereas in this country, it's part of our vaccine. And you see that the trends overseas are that the Americans and the Italians and even Iran are being hit extremely hard because they don't have BCG in their vaccines. We've got it. It's a very important vaccine for us to protect us from tuberculosis. But we also believe there might be a role of playing in the whole coronavirus. Still unproven, but we're still looking at it and saying it might be a positive thing.
But just to keep things in perspective, it is not necessarily, as you said, it's unproven. We do know of South Africans living overseas who are very ill with this disease. So it's not necessarily...
Look, once again, it's also, we're talking about comorbidities, people with other problems, people with other issues. You know, each case needs to be looked at individually. We're looking at the national picture here. We're not looking at an individual picture here. And we're hoping and praying that, please God, this will be okay. I mean, there's a lot of talk, since we're speaking about BCG, about people with HIV. You know, people who live with HIV have got what we call a dysregulation of the immune system. So they don't mount an immune response typical to what a person without HIV would mount. Therefore, we're hoping that they won't be as badly affected by the coronavirus as somebody without HIV would, because they can't mount this immune response and they can't mount these cells against it. By immune response, we mean when you get a fever, when you get a cough and the short of breath, that's your body's way of it showing that you're mounting a response to this virus. And we're hoping and praying that people with HIV can't mount this response and therefore will be more protected. So hopefully we've got twofold protection. Hopefully the BCG will help, and hopefully people with HIV will not be affected as badly as we think. I mean, when you look at influenza, our influenza picture in this country, people with HIV aren't severely more affected than people without HIV. So please God, that's a big thing.
Can you just explain to me what herd immunity is? We're hearing the word thrown around a lot, and it just doesn't quite make sense to me what it is.
So the herd immunity is part of the whole flattening the curve theory. We want to flatten the curve, and by flattening the curve is keeping people at home and not letting them go out and infect other people. The herd immunity itself is when people get sick, they get the virus, and then they form antibodies to the virus, and then hopefully when they go out, they can't get the virus again. And I think it's very important to discuss antibodies and antigens and that whole thing, because people hear the term antibody, antigen, and what does that actually mean? So it's important for the testing to know an antigen, because the tests we do, where you stick the swab into the nasopharyngeal area, which is the back of the throat, or the oropharyngeal area, is an antigen-based test. It's a polymerase chain reaction test where basically a toxin, virus, bacteria, or foreign body infects the immune system and then creates the formation of antibodies. And that's that test that we do. It takes a number of hours to days to get that response. The antibody is a protein that is formed by the white cell count that hopefully disables the virus. Now, what they're doing in the United Kingdom and many other countries is they're hoping to test the antibodies, okay, which is a blood test, which they can pick up on a blood test to say, do you have an antibody to the virus? If you do have an antibody to the virus, that's part of the herd immunity, then you can go back to work. This is how they're hoping to test it overseas. We haven't got that here yet, but that's a great test forward to see, can people go back to work? Have they got herd immunity? And will they reinfect other people? So it's very important. There are two types of tests now. One is for your antigen, which is a test we're doing, and the other is the antibody. The antibody test will hopefully help us in the future going back to work and getting out in society.
Understanding how people can go back. All right, and Anton says, we're having a baby in a month's time. What advice can you give us? Do you think the hospitals are going to be even stricter a month from now?
Unfortunately, yes, they are. The hospitals are very strict at the moment. I read an article yesterday that even doulas aren't allowed to go to the hospitals, or birth mothers, and patients have got to choose. Either they want the birth mother or they want the father to go with. There's only going to be allowed one parent to visit the child a day. So it's not both parents. The hospitals have to be strict. They have to be strict. This is the place where we want to protect people. We want to stop infection from coming in. So in 1 month's time, most likely you're going to be doing this alone, but you have to be protective and protect your baby and your wife and your family.
And are hospitals asking mothers that have just given birth to leave quicker? And would you recommend that they leave as soon as they are able to?
It all depends if you have a natural birth or you have a cesarean. There's certain time you need to heal. So at this point in time, natural births go home very quickly. Cesareans take up to 3 days to go home. And you've got to watch people for complications from cesarean sections. So there's no overt thing to push people out of hospital.
Right. Okay. I'm with you. Countries like Sweden and Netherlands are not instituting lockdowns, but rather employing other methods to beat the virus. What are the pros and cons of such an approach?
Look, I think, as I said last week, you can't watch a video of a beautiful woman telling you that they're doing this and that and saying, wow, it's amazing they're doing this, but you're not getting any of the actual data from that country. Nowhere in that video do they tell you what the data of that country is and what they're actually doing. Each country has to look after itself in that way. We know what our pros in our country are, our cons in our country are. We know what our population is. We know what people do. We've got to do what's best for our country to protect ourselves. So we can't compare ourselves to another country. I mean, we can't compare ourselves to the United States. We can't compare ourselves to Russia. Russia is an anomaly to me. I mean, Russia has got minimal cases at this point in time. Think about 4,500 to 5,000 cases with minimal deaths, 43 deaths. Ramaphosa had a meeting with Putin last night to discuss what they can do and how they can bring it across to us. I mean, it's unbelievable.
Yes,
we don't know.
Unbelievable is exactly.
Yes, we don't know if they are testing, they're not testing, they're lying, they're not lying. Who knows?
Right. Yeah. I would. Yeah. No, my thoughts are not important right now. Certain countries, we've spoken about antibodies, and again, another question around this: the fact that some countries experience more severe cases and deaths than others. Is it mutating, or are just some weaker strains? That really goes back to the answer.
So that goes back last week. We don't believe the virus is mutating at this point in time. There's no obvious mutation, but different people are having different affectation to the disease. South Africa did things right from the beginning. We locked down 10 days. Today's actually day 10 of lockdown. We locked down 10 days ago, okay? Even before the lockdown, we were social distancing. People weren't shaking hands. People were doing hand hygiene. People were doing things right. In America, up until beginning of last week, they were still having big community functions. They were still having over 100 people. They were still having prayer gatherings, and their virus was going out of control. Here, Ramaphosa put his foot down. The health minister put his foot down and said, this is what we've got to do to protect our country. That's why it's worse overseas at the moment. We may still be lagging in this lockdown phase. We don't know that yet. And that's why it's so important to continue the lockdown further, to see that more virus doesn't spread, or the asymptomatic people can't spread it to other people. So it's still early days for us. We still lag 2 to 3 weeks behind the rest of the world. But we're also going into winter in our country now. We're going into a winterish type season. The weather yesterday was horrid. It was raining. It was cold. People get sick. People are going to get flu. We've got to protect ourselves and protect everybody else throughout this period.
One of the reports that I read suggested that this coming week and next week are the most crucial in terms of understanding where it's going in South Africa. Would you agree with that?
I would agree with that, because I think because our numbers are so low, people are trying to be complacent now, and they're saying, well, it's not so bad. Don't worry. Please don't be under any illusions. It can spiral out of control completely. Our estimates prior to lockdown, that if we didn't lock down, we would have been between 5,000 to 7,000 cases by now. Because of the lockdown, which has been extremely effective, our numbers are low. That doesn't mean in a week's time the numbers can't go up more as we've predicted. It will go up. We know it will go up. We've got to curb the spread. We've got to keep that herd immunity. We've got to flatten the curve. It's crucial in the next 2 to 3 weeks to keep everybody indoors.
This is from Twitter. We need to talk more about pink eye being a symptom of COVID-19. That's the first outcome.
So I think people are also confusing viruses and allergies. Any prodromal virus can present with itchy nose or red eyes or allergic eyes or pink eye type of symptoms. That doesn't mean you've got coronavirus. Once again, when do you test? You test when you've got fever, shortness of breath, cough, after discussing it with your health practitioner. That's when to test. You don't go and test if you've got pink eye. We are increasing the number of testing we're doing in the country. It's improving. There's a lot more tests being done. The labs are catching up at the moment. We're waiting with bated breath for the 5 to 10 minute test that's going to come from overseas in the next few weeks, hopefully. But we can't test everybody all the time because we don't have the supplies for that. And I think we just got to watch out for small symptoms that are just basically virus related. As I said, we're going into influenza season. You are going to get a pink eye. You are going to get a runny nose. It doesn't mean that you have got coronavirus. You've got to have other symptoms associated with it.
And just to add to that, I think the advantage of speaking to your medical practitioner, and a number of people, I've discussed this with a number of people this week who have flu-like symptoms, but have spoken to their medical practitioner and who have said, look, you get this every year. We know you. We know this is typical of of what you suffer from. And I think that's also important to help keep a bit of perspective.
Yes, it's very important because that's the whole point of having a family practitioner. They know you. We know what you do, how you do it. We know how you behave. So it's easier to follow you and understand, are you sick because you've got COPD and this is how you're going to just have a normal cough? Or do you have a fever, shortness of breath, and should you be what we call a person under investigation? Person under investigation is someone who needs to have a swab.
All right, so taking a look at Facebook, Tanya says, if we're using, going back to that conversation around the masks, and let's say you use a cloth mask, can you use it a few times after you've gone out and in and then wash it, or do you have to use a new one every time you come in and out the house?
You can use it a few times. I mean, the point is, ideally, if you go out, come back in, wash it. It doesn't take long. You put it under cold tap, wash it with soap and water, and then dry it. It won't take long at all. But the point of it is, how many times are you going out? We're on lockdown. You should be at home. So go out one journey and then stay at home.
Right. Sonia, we've answered your question. Bev,
and I've just got to say one thing while we're discussing that. Mm-hmm. Anyone who's caught running on the road should be named and shamed. People shouldn't be running on the road. We are in lockdown, okay? It peeves me off dramatically to see people running on the road when other people are staying at home and following the rules. Stay at home. There are reasons for this. 2 cents worth.
All right, well, there we go. Funny, I didn't even ask that question, but still. Carla wants to know an important one. She says, once contracting COVID, does one build up immunity, i.e. antibody testing or screening? Yes, I think you've already answered that question.
I think we've answered that, yeah, and that's the whole point of doing that antibody test when it comes here, to see if you have got antibodies, have you got immunity to the actual virus, and can you go back into the public domain?
Okay, Hilton wants to know, we're halfway through the lockdown. When will we know if it's been effective? I guess the whole way through, because...
you just got to watch the figures as we're going along. As I said last week, don't be surprised if the numbers do shoot up. They are going to shoot up. We know that. And the way we act towards the numbers going up, which will determine the future. So if the numbers go up dramatically, yes, we have to lengthen the lockdown more than we think, but I still believe we do have to lengthen this lockdown.
So here's a question from Twitter as well for you, for Dr. Meyberg specifically. How long will you cry for if they scrap the Premier League season and Liverpool don't win the league?
So I couldn't hear that, but I thought you said that Liverpool are going to win the league despite them scrapping the season. Thank you very much. You will never walk alone.
All right. And what is the percentage of recovery of people that are on ventilators? If you get to the ventilator stage, is that it? Or is there a chance of recovery from, et cetera? Can you just give us that?
It's a very tough question. It's a very tough question at this point in time. Overseas, it's the numbers are very bad. Here in this country, so far, our numbers are quite good. We have got a lot of task groups, a lot of protocols that are set up, a lot of ICU groups. This is the first time in South African history where every single ICU doctor is working together as a unit. We've created ICU WhatsApp groups where we are putting on all of our experiences, detailing what we're doing, what we're seeing. We've got people running it. We've got people like Professor Guy Richards, who's the critical care professor, who runs the whole group, who's advising us what to do, what people's experiences are, what drugs to use, how to use them. So by the time they get to be on a ventilator, we're hoping already that we've hit the virus hard and they won't be affected. That being said, people on ventilators have got a much worse prognosis if they're on a ventilator, because that means they're already in what we call acute respiratory distress syndrome, and their lungs are flooded with all these cytokines as inflammatory markers and all these things that are causing damage to them. So there's a 30 to 40% chance that the prognosis would be poor with a person on a ventilator.
Carl Coleman says, this is one of the best programs on coronavirus pandemic. It deals with the situation in South Africa without all the jargon. So thank you, Carl, for that. Andrea wants to know, does immunization from childhood strengthen our immunity to fight this? We've spoken about the CG, what was it, the
We've spoken about the BCG, and we've also said that you've got to have your influenza vaccine, very, very important. If there's no strain 4 of the influenza vaccine, then have the strain 3 at the moment. Beggars can't be choosers. We've got to get what we can get at this point in time.
Yeah, Peter Fan also wants to know about the BCG vaccine. We have answered that question. Anything else that we haven't asked you that we should be asking? Boxes or briefs? I don't know. Anything?
So I think maybe just to reiterate a few things. The lockdown is important. Okay. By keeping the lockdown going, we'll basically prevent the resurgence of the viral infection, which is very important. Masks are contentious. Should you wear a mask? Shouldn't you wear a mask? Yes, you probably should wear a mask if you're going into an area where there are lots of people and people aren't obeying social distancing. Yes, you should wear a mask if you're on a taxi. If you're desperate to wear a mask, then do wear a cloth mask. We do need to prevent the surgical masks being used up. We do need to prevent N95 masks being used up. No one on the street should be wearing an N95 mask. It is not necessary for the normal person to wear an N95 mask. Wear a cloth mask. If worst case, wear a surgical mask. But remember, you've got hundreds of thousands of healthcare workers in this country that need these masks to protect themselves so they can eventually protect you. If they run out of masks, then the virus is going to go out of sync and we won't be able to protect anybody. So once again, it's contentious. We don't have a yes answer. We don't have a no answer. We know what the CDC says. We know what the World Health Organization says. Use common sense. Be practical. Wash your hands. Keep social distancing. And you're in lockdown. Don't go out more than once a day and don't go out for hours.
Absolutely. Absolutely right. Dr. Anton Meyberg, if I might say, you seem a bit more relaxed this week than last week. Is it because you feel that we are handling it appropriately here in South Africa?
So I think there's many reasons. Yes, we are handling it appropriately, and we're getting great and unbelievable guidance from the presidency and from the National Health Department. But I also think we as healthcare workers are understanding it more because we've seen cases now. And until you've seen your first case, you don't understand what the stresses are and what it actually means to have a case in your hospital. Once you've had a case in your hospital, you understand how important it is to don protective clothing, how important it is to take your time to take off, we call it doffing, taking off of the protective clothing, and how important it is to protect yourself. Once you've done these things and once you understand them, it makes you more relaxed that you're doing the right thing and you're able to cope with what's going on.
Thank you, Dr. Meyberg. I'm Howard Feldman. This is your Synthesis Sunday podcast. I've been chatting to Dr. Anton Meyberg. He's a pulmonologist physician in a private practice. He's a COVID-19 expert. We speak to him every Sunday. We ask him your questions. We throw in a few of our own questions. And together we hope that you are keeping informed. The takeaway message, stay home, stay safe, and stay healthy. Thanks, Dr. Anton Meyberg. You have a great day. Hopefully a great week, and we'll speak next Sunday.